Good morning and welcome to today's webinar. My name is Jocelyn Protopappas and I'm the Manager of Special Projects at the Center for Excellence in Aging and Longevity at San Diego State University. I'm also very excited today to be the moderator for the first edition of our CEAL Tech Talks. This series is designed to give a platform to innovators in the tech industry who are reimagining what it means to age in a rapidly changing world. As a millennial, I know I personally grew up alongside technology and I've seen the evolution over the years. From floppy disks to facial recognitions to AI assistants, there's been a lot of change. I remember in grade school, very fondly, I remember this, my mother brought home Encarta, which was an encyclopedia on CD-ROMs, which meant that from the comfort of my own home, I could do deep research on toucans whenever I wanted. No need to stay late at the library or check out a book as big as I was. I could learn about toucans anytime. So needless to say, technology, we've all seen how it can help to connect us and support us. We've also seen how sometimes it can really complicate our lives. In today's discussion, we are going to be talking about how technology can help to ease the lives of caregivers. As many of you know, today is National Family Caregiver Month. So it feels really fitting for us to be talking about the intersection of care and technology. We have a really great group of people in no particular order here. We've got Luke Marrow joining us from Mobius Mobility. He's going to be talking about the iBot today. We have Todd Smith, who's going to be talking about Odessa Connect. And then we have the Togersons, Kelly and Blake, here to talk about Reacher Technologies. So in fear that I may continue to reminisce about toucans and online encyclopedias, I am going to stop sharing my screen now and turn it over to our panelists to share a little bit about themselves and their technology. So we'll go right down the row here and we can start with you, Luke.
Thanks, Jocelyn. Hi, everyone. So I'm Lucas Marrow, or Luke for short. I run Mobius Mobility here in Manchester, New Hampshire. We develop, manufacture, and distribute the iBot personal mobility device. The iBot is a multimodal product for people with different ranges of disability. So our users vary in age, from age 8, I think is our youngest, to age 93, I think is our oldest. And they range in disability from folks who might have high-level quadriplegia or spinal cord injury, maybe advanced MS or ALS, down to folks who simply have trouble walking due to arthritis or recent surgeries or just general kind of muscle fragility and weakness as they get a bit older. We've been producing the product since 2019 and are currently distributing it primarily in the US, but also across Europe. And probably the best way to learn about it is for me to show you a video, which I'll do. It's about 3 minutes long. I'll try not to narrate too much, but it'll give you a sense for what the product can do and who uses it primarily. So let me see if I can deal with my sharing. Whoops. Of course I can't. Everybody see my screen, I hope?
Yep, you're good, Luke.
Great. So yeah, as I mentioned, this is about 3 minutes long, and it shows the iBot both here in our training ground and also out in the real world. These are all actual users. What makes the product unique? As engineers, we like to think that it has different operating modes. There's a balance mode that enables people to get up and move about at eye level. There's a 4-wheel mode, which follows terrain and can get you up and down curbs and through all kinds of snow and sand and out onto the beach. It does follow terrain, so people with limited trunk control, they always stay level when they're in the product. But what we hear most from users is they don't really care about the modes. What they care about is they can go from point A to point B with a lot less hassle, planning, and kind of mental overload. And that applies both to the users and to the folks that help them in their day-to-day and take care of them. From the user's perspective, rather than having to figure out, do I need to go and avoid places where there is no elevator or there is a set of stairs, where there might not be curb cuts, here in New England where there could be snow and ice, they can just go directly to where they need to go. And from the caregiver's perspective, a lot of the benefit is just making that user more independent, but there are a number of features in the product that if a caregiver is involved in the user's life, it helps them do things like transfer them on and off the product, take them up and down stairs, and even control it fully if the user cognitively isn't in a place where they can operate the device. The other way it really helps the users and caregivers out is just with reliability. Unfortunately, wheelchairs are notoriously unreliable and slow and expensive to service. So the product is very well engineered. It runs a mean time between failure that's 2 to 3 times better than a typical wheelchair. And we've engineered it so that if something goes wrong in the field, that it is easily replaceable, the customer or their caregiver can do it without a service call. Yeah, it's covered, the product's covered by insurance. That's a recent development, is we were accredited as a Medicare and private insurance provider earlier this year. And so it does have partial coverage through Medicare and private insurance, but that's been a big help. And coming up in 2026, our plans are to basically extend our country coverage, and we're continually finding ways to make the product appropriate for people with different levels of disability. We started out with a seating system and a control system that was more appropriate for folks with paraplegia or semi-ambulatory. And then this year we added a powered seating system that helps people with higher levels of disability. And we're going to continue that in our roadmap in 2026.
Thank you, Luke. We'll pop over to Todd. Look, I was just so impressed by the driving on one wheel. That was incredible.
Yeah. That's probably the user's favorite mode. If you think about it, being down at belt buckle level, it's not a lot of fun socially, I think psychologically, but also functionally. So people can reach cabinets, they can reach shelves at work. Workers' comp has been very good to us in terms of invoke rehab. If someone needs to access higher spaces, they need to get out on terrain, on construction sites. Things like being able to be up at eye level and get across terrain are really, really important to folks. So there's both a functional and physical and a psychological benefit to some of these modes. And again, the intention is, getting away from the engineering is like, just like an able-bodied walking person does. We want someone to get up in the morning and to the extent they can, go where they need to go directly, point A to point B, less planning, less hassle. We have one customer in the New York City area who is a management consultant, and his commute was taking 2.5 hours each way because the elevator at his main subway stops wasn't working. So we go actually past his office, change lines, and come back. And now he climbs the stairs and his commute's 25 minutes. So that's a good kind of real world example of the benefit of having these different modes available to people. So.
Oh my gosh. Yeah, we're going to talk later about how you can measure impact, but I'm certain anybody who can shave an hour and a half off their commute time is really grateful.
Each way.
Each way, right. Right.
Yeah.
Well, thank you, Luke. I'm going to pop over to Todd now.
All right. Well, thank you, Jocelyn, for hosting this conversation, and glad to be here. And thanks everyone for spending a few minutes with us. I am Todd Smith. I'm the founder and CEO of Odessa Connect. We are based in Louisville, Kentucky, and I'm going to start my timer here so I don't go over. I'm going to show a short video, which, a picture is worth 1,000 words. And a video is worth 1,000 pictures. So I'm going to show a short video, and then I'm going to switch over and show a few slides. And hopefully by the end of about 5 minutes, you'll have a really good idea what Odessa Connect is. So the big idea behind Odessa Connect is to enable a large screen experience for older people or people who struggle with smartphones, apps, passwords, downloads, all these sort of micro frustrations that are a part of the everyday digital experience that are non-issues for digital natives, but become real roadblocks for analog natives, as we lovingly refer to older people who didn't grow up, clutching smartphones. A lot of the digital wayfinding the digital culture, the language, the iconography is not intuitive for people who did not grow up with these things. Words mean different things. Icons are cryptic. Screen sizes, tactile issues, interfaces. So all of these things add up to real roadblocks for a lot of older people. And then we get this sort of, I'm no good at that. I don't want to use that. That stuff's for kids. This rejecting sort of wholesale the digital experience, and that's a real problem that we think is addressable um, through design, through optimized design. So the main thing that we did was migrate that experience from the small screen to the big screen. So the television is a universal device. It's not a new techie gadget that is, hard to understand. It's just your TV. It's everybody has one. It's on many hours a day. So by enabling the technology experience or the digital experience through the TV, now we're getting much higher engagement in things like telehealth and sharing with the family and learning and all these other great things that technology brings. But many older people feel shut out of because the interfaces are forbidding. So that is the backdrop. Actually, I should say we have the key to the whole thing is our remote control. So this is a proprietary remote. We designed this in collaboration with geriatric physicians. It is highly optimized, I always say, for older hands, older eyes, and older minds. If you have fine motor skill impairment, you can hold this and use it. If you have visual impairment or mild cognitive impairment, you have no problem here. And basically, we go in and program this for your TV, and then you can get to your Odessa content as well as your normal TV content using this clicker. So that's the backdrop. Let me show a short video and then a few slides, and then I'll stop. All right, 1 second. Everybody can see that?
Potential ramifications moving forward here for Dallas.
It took 2 months for the Mavericks to go from buzzing about a blockbuster trade to busting.
Very good.
Hey, Mimi, how are you doing?
I'm doing just fine, thank you. How are you?
I'm good.
Can you see me all right, Michael?
I can see you perfectly fine.
Oh, good.
Did you have you take your medication today?
Yes, it's right here beside
All
me.
right. I know you don't like taking it, but
I
you
know.
got to make sure you're always taking your medication.
I know. I don't want to have any happenstance things happen to me. So, anyhow, I loved all the pictures that I got from your wedding, which was in December.
I thought you looked so amazing in those pictures.
Oh,
they
thank you.
they looked great. Did you get the video I sent you from Costa Rica?
Yeah, I sure did. You sure did. And I love it. I really do. It's a great to see all of you having a good time in the water and on those wires. What did you call those wires?
Zip lines?
Oh, yes, thank you. I can't ever remember
Yeah.
that. But then, I'm an elderly person, so that's what happens when you get to be my age. So, anyhow,
Hey, one thing I wanted to ask you too is, do you have any doctor appointments coming up this week?
not this week, but I'm going to see Dr. Dillon on the 21st of this month.
Okay, so I'm going to stop it there. Wanted to give you that idea what that experience was like for the older person through their TV. And the big takeaway is, we built this as a family communication tool, but now we're using it for healthcare providers, home care providers, PACE programs, actual clinical use cases. So it's not just family connectivity, which is very important, but it's now telehealth, remote patient monitoring, healthcare screenings. So you can imagine for many older patients who might struggle with the small screen, there is no there is no telehealth experience. There is no connectivity. So we can circle back on this later during the Q&A, but having the Odessa or not can be the difference between actually engaging with your healthcare provider virtually or not. So it becomes not just a nice to have, but actually that's about 6 minutes for me. So I'll relinquish.
Well, Todd, I'm hoping because I know a little bit about Odessa, can you show everybody the like main screen at least that people see so that they can see all the features that Odessa
Yeah,
has?
sure.
I think that Lucas like ceded 2 minutes of time to you. So on this very strict regimen here, we'll let you let you keep
Okay.
sharing.
Okay. All right. Let me know if you can see the slides.
Yeah, you're good.
Okay. So there's your remote. So this is what the patient will see on their TV. The screen, when Odessa is installed on your TV, it powers up to your TV, and that is, the alternative is the smart TV menus with all the apps and the icons flying around is very confusing and overwhelming. So we love this booting up to Odessa, and then you can press your purple star button or your blue TV button. Your purple star button really is your home button, but again, optimized for the older person who may not intuitively know what a picture of a house does, right? That digital natives know what that does, but analog natives don't. So we say wherever you are, you can press the star, and that will take you to your Odessa main menu, which Jocelyn, I think this is what you were thinking of. So this is, sort of like a giant iPad in the living room. Now we can use our arrow keys on the Odessa remote and navigate around this menu and then go in by pressing the OK button. You can go into any one of these tiles. And this is a mixture of messages from your care team, from your doctor, from your family, medication reminders, health education. This is a super quick flyover, but just to give you a quick visual, the family content is, again, it's not just a nice to have, it's part of the engagement. We want people to think of their Odessa just as their digital portal. It's not just a clinical tool. That's part of the engagement. The RPM, this is vitals devices, vitals tracking in real time, health screenings. These are automated questions that we can continuously scan for self-reported data. And then this is what the incoming video call from the care team or the family looks like. Okay.
Thank you, Todd. Yeah, I just wanted everyone to see that main screen. And every time I hear about the Odessa, I'm like, man, the beauty of a universal remote. At my house, we're like, turn the TV on with this one, change the volume with it. Yeah, so this is cool for many reasons, but just that one remote is really fantastic.
Well, the remote is a pain point for everybody of any age,
Yeah.
right?
Yes.
Especially older people.
All right, I'm going to pass it over to my friends, the Togersons, to do their introduction.
Hi, I'm Kelly. I'm going to start us off and Blake will finish us up. Just a little about our background. First of all, Luke and Todd, I want both your products immediately. I have a dad with Parkinson's. I'd love to be able to take him to the beach and back on a fishing boat. And Todd, I cannot tell you how many times I go over to his house to make this remote work. So you definitely found a customer right here. Our story is a little different. It's probably not that different though from most of you. My kids and I have 3 kids. We moved in with my parents about 7 years ago. My dad had Parkinson's. He now has dementia. And we moved in after I got divorced to help them. It was kind of a mutually beneficial thing. And so we were here as he started to digress with the Parkinson's and with the dementia, and no product on the market helped our family with what we needed. There was, the help, I've fallen and I can't get up, but it goes to a third party call center. And we just needed to know my dad needed help and to be able to be in a different room. My mom needed a break as basically full-time caregiver to be able to go down in the yard and garden and get away just for a little bit. And he needed people not hovering. He needed to sleep in a separate room now because with Parkinson's, you start to howl in your sleep, and you can get quite violent actually in your sleep. So it wasn't safe for my mom. But if you have a baby monitor on all night, you're still up. So we ended up inventing what we didn't have and what we needed, Reacher Technologies, with a wearable. And I'll let Blake go into the details of the wearable. But for someone like me in a sandwich generation, I've got 3 kids I'm raising who are still at home. I've also got aging parents with dementia and Parkinson's, and I work full time. And I was worn out, just completely worn out. I'd stay up till 2 o'clock in the morning to finish my work so that I never fell behind. But the guilt, and most of you who are in this situation, the guilt of, am I doing enough for my kids? Am I doing enough for my parents? Oh my gosh, am I doing enough at work? All the way around. And what's happening is, luckily my parents saved for retirement, but even all they saved is probably in today's day and age not going to be enough. So we see the value in being able to stay in your current situation as long as humanly possible, because when you go from home to caretaking in each step, it gets substantially more expensive. And what happens is, even if our parents saved, they're most likely in today's age going to run out. And it will then fall on us, the sandwich generation, to take care of them. And in turn, it trickles down then to our children because our savings get strained. It's also causing millions of women, mainly, to drop out of the workforce for caretaking purposes. And we are losing all ranges, from CEO to you name it. It doesn't matter. They're having to leave for caretaking. Our device allows you to better keep your job and care for your family and balance everything in a way that makes sense, that everybody can afford, because that was important to us. And I'll let Blake go into the specifics of all of those things, but I can guarantee you, if you're feeling alone, you are not. You are in a very large group of millions of us just trying to do the right thing for our parents and for our families. So Blake, take it away and let them know what we got.
Sure thing. Yeah. So it's a pleasure to be here. And I am Kelly's son and co-founder. But more specifically, I'm tech native. So machine learning makes sense to me, and all of the screens make sense to me. Putting my Apple Watch on my grandfather with Parkinson's did not make sense to him. And what ended up happening is he put it on, walked outside, fell, and I see him trying to operate the crown on it and then work an LED screen in a time of crisis. And it didn't even work. You know, he couldn't operate it generally. So it kind of prompted this discussion around, how do you have a really complex back end of the system, but the end user, all they have to do is press a button. So that brought us to our solution. It is a sleek wearable that is not going around your neck. It's not some white box. And when you press it, the fire department's not going to come kick your door down when all you needed was somebody within a mile's radius to come help. So the two functionalities, at least on the emergency response side, is your help button. You press it, and using our chargers of the wristband, we're able to know exactly what room you are, whether you're inside of your house or inside of an enterprise senior living community. Which is great because the accuracy of that is, one, lacking in competitors, and two, extremely important in a time of potential need. And then the other big feature is a check-in button. So say I'm in Florida with some of my friends, and they're like, oh, you know, how's Dave doing? I just want to check in on him real quick. Through my app, as a digital native and somebody who is fine with a smartphone, I'm able to initiate a check-in. His wristband just buzzes twice, and he goes, oh, okay, I'm going to press it, and let Blake know that I'm doing okay. But he doesn't have to have an app, and he doesn't have to install anything into his home or room, and there's no infrastructure. So all he has to do is plop it on his charger, pick it up in the morning. And the design of it was really important to us at the Reacher team because it needed to pass the Dave check. So if he didn't want it, or if he thought it was going to make him look somewhat invalid or that he's aging, he's not going to want to wear that. And neither did his friends, who are, veterans, ex-judges. So the actual design of the wristband itself, and making sure that it could roam outside in urban areas, and then be accurate inside, was extremely important. So the simplicity of the wristband can be met with new technology such as advances in the IoT space, and a really talented back-end team. Then the other thing is data collection. So using machine learning, we're able to know, how long has he been in his room? And if he's been in his room for 18 hours straight, there's probably something we should, evaluate, even though we've done a check-in. He says he's all right, but that may be showing an interesting trend. The week before he was doing, 6,000 steps a day. Now he's doing 2,000 steps. And rather than have to go actually interview him and, spend the time and ask those questions, our wearables collecting all of that data and then sending notifications with movement and vitality reports direct to our phone, and then the administrative dashboard of each of these facilities. So that's kind of what we do, and excited to hop into the panel here to answer more questions and kind of give our take of how we can help.
Wow, this is a very eclectic group of technologies. Thank you all for sharing. It's so amazing to see the way that you've all figured out a little niche and figured out how to address a major challenge. So the first thing I want to just ask is, some of you sort of hit on when you were talking about your devices, how you measure success. And so I want to talk about that. What indicators or outcomes do you use to evaluate, that is, whether your technology is truly improving quality of life for older adults and their caregivers? So what are the measures that are used?
I'd love to take a stab at. Oh, go ahead.
Go ahead, Blake. You go first. Go ahead.
Sure. Yeah, I think the kind of obvious one is, are they wearing it? I think the biggest kind of KPI and risk when doing a wearable is do people want to wear it? So it's like, I wear my Apple Watch every day because there's features about it that I enjoy and that I use every day and that I identify with. I like to be seen with my Apple Watch because I train for Ironmans. And a similar kind of process of thinking can be cross-applied to any market. So especially one where they're like, hey, that doesn't look like you're aging, but that looks like, oh, you're active, and is that a Fitbit? That looks cool. That's a big indicator of success for us is, do they wear it, and are they showing their friends rather than hiding it from them?
I really love that, Blake, because I think, we talk a lot when we do a lot of listening sessions at CEAL and talking to older adults. And there is this concept around not wanting to wear devices or things because it makes you feel old, including things like hearing aids, which can be a big challenge. So I love that you guys are taking into consideration, that piece about making it sexy, making people want to wear it. I like that. You didn't say that word, I added that, but I think it's a really critical piece, because I think these older adults nowadays are a lot different than our grandparents. So I love that. I'll throw it over to you, Lucas.
Yeah, so we're fortunate in that there's a set of validated, independently developed assessment tools that are available in the field of disability. One of the primary ones we use is the FMA, which is short for Functional Mobility Assessment, and that is administered by a nonprofit that's associated with the University of Pittsburgh that developed it. And it basically does a check-in at the time someone receives a new mobility aid, and it assesses to what extent and their level of difficulty in completing various ADLs, activities of daily living. We recently worked with them to expand it from not only inside the home, but outside the home, because a lot of the regulatory and reimbursement world that disability lives in is unfortunately still stuck in the 1960s, and it's focused on basically keeping people in the home. But it basically measures how much you change at initial delivery, where you're at in terms of those ADLs. And it does a check-in, I think it's once in the first 30 days, once at 90 days, and then once at 6 months, and then annually thereafter. And you can basically measure from one device to the next, and within one person and across a population, how did their ability to complete different tasks basically improve. The other way we measure it is we do our own just satisfaction surveys on product features and service. Service is a really big deal in our world. If your wheelchair goes down, it's like your legs don't function. You can't move, and it's actually dangerous. Like if you can't get to a doctor's appointment, you can't get to your medicine, you get exposed to pressure sores because your wheelchair is not, let alone the usual conveniences that most people would think about. Like if your car breaks down, it's 100 times worse. So we measure our responsiveness in service and reliability of the product. And the last thing we do is with the user's consent, our product essentially has a black box. So We like to measure how many hours per day, kind of like Blake's point, how much are they using it? How many hours per day are they in it? In what modes are they using it? How many hours, how many miles? Touching on Blake's comment about machine learning, we're factoring that into predictive maintenance for the product. Basically looking at how often do different components fail, what kind of signals do they throw off before they fail, so we can get in front of a service problem. And on that last piece, it's still early days, but it's starting to show some real benefit. About 90 last quarter, 93% of our service calls were either resolved over the phone through remote diagnostics or sending the user, usually soft goods, cushions, backrests. Sometimes they break the joystick because they run into stuff with it, but nothing fundamental like a big tune-up or service call like it'd be akin to again, the analogy to a car. And I guess the last thing I would say is that, you know, honestly, in the field of disability and wheelchairs, the threshold is just so low. There's 5 million people who use wheelchairs, their form of mobility, outside of hospitals and assisted living, out in the community. There's another 11 or 12 million or so who use a cane, crutch, or walker as a mobility aid. And especially for the higher degrees of disability, it's just not, you know, if consumers in other markets were treated the way these consumers are, there'd be riots in the streets. They really are underserved, and we're trying to address that both with the product features, but also the service and outcomes wrapped around it.
Yeah, I hear that. I want to ask you, I'm just really curious because both you and Blake sort of touched on this, I'm sure Todd will too, but you're using a lot of consumer-driven feedback. What is one change, if you're allowed to share, what is one change that you've heard from consumers that has made a change with the iBot? Or if that question makes sense?
Yeah, totally makes
Yeah.
sense. Yeah, so one is, so when we initially came up with the concept for the device, we were very much focused on stairs, because as able-bodied, to be clear, we had engineers with disabilities on the project, but as engineers, that was the most visual need to us. It's like, how outrageous. And I can see out my side of my window, but I live in Manchester, New Hampshire, which is an old mill town. It's got tons of stairs, tons of obstacles. It's not accessible at all. And what we learned after we launched the product actually was stair mode was used the least, because most people, if they've had a disability for a while, have already moved to someplace without stairs. And a lot of their accessibility challenges was out in the world. And one of the modes you saw was 4-wheel mode, which we thought would be nice, but how often you go to the beach, how often you want to go, obviously it's important. But what we learned was that was the most used mode, because when people needed to go to work, go to a party, go on a date, they wanted to get across town. And once they got out of their apartments or their relatively accessible home, they couldn't do it. And so what we did in response to that was, we already had the mode, to be clear, it uses more battery power. So we added battery capacity so we could give them the range they wanted when they were out climbing curbs and going through snow and sand and stuff. And yeah, and the other thing we learned was balance function, where you're up on 2 wheels, had we knew it would have a social and psychological benefit, but it's turning out, because of the FMA measurements we've been doing, to have a functional and an employment benefit. It's actually a really big selling point to workers' comp and voc rehab folks, because you can get people back into the workforce. They can lead a meeting, they can reach, I think we have like at least a half a dozen users who work at like Home Depot or Lowe's, the hardware stores, because
Yeah.
they're stocking shelves, reaching out for shelves. They can do it like anybody else. And we didn't anticipate that. We thought it would just be more like a nice to have, doesn't do it justice, but more of a purely social, important, but not, may not be so important, frankly, to an insurance company. But it turns out in some contexts it can be. So
Very cool, Luke. Thank you for sharing that. I love that you've also incorporated so many people with lived experience in the actual like manufacturing and engineering of the device as well.
Yeah.
All right, I'm going to popcorn over here to Todd to talk about outcomes and measures.
Yeah, and my camera has decided for some reason to, I've got a little red triangle on my camera icon, so um, you're not seeing me, right?
No, we're not seeing you, but we'll imagine that you're there.
All right. Well, sorry about that. Yeah, so definitely measure the basic stuff: engagement, usage, how many family members are connected, how many minutes of video call time do we have per week, per month? Are the patients reading their Odessa messages? Are they clicking play on the videos? So those are sort of the baseline engagement metrics, because if we want to see obviously high engagement and high read rates on the messaging, which means the person is engaged in the system. If we don't see high engagement, then maybe there's a technical problem, or maybe a understanding problem, and we'll work with that user. But we really want to take, at this point, what we're working on is taking that all to the next level and actually correlating usage to hard clinical metrics like ER utilization, unnecessary trips to the hospital. We hear this all the time from healthcare providers that people are going to the ER not out of medical necessity, but out of social necessity, right? So this is a big problem, because if someone is calling 911 because they feel lonely, they feel anxious, they're alone, they don't know what to do, maybe they don't feel good, pick up the phone, go to the emergency room. That's just not, it's not good for the health system. It's not good for the patient. So we anecdotally believe, with to our DNA, that if a person has active social engagement and they have connection through the system, we are going to prevent some significant, we're going to move that needle. If we can intervene digitally, virtually, and so the person doesn't feel so alone, then they're not going to go to the hospital every single time. And that is a hard clinical metric. We're trying to prove that out with the data right now. So we actually are shopping for a proper research partner to do that. Someone who knows how to run that clinical study. But yeah, so that's our next frontier on metrics.
You've hit. Oh no, go ahead, Kelly. You go ahead.
I just want to piggyback on something that Todd said with the ER, that one thing that we kind of have in common with what he's doing with the current wearables, all have the third party. And so immediately an ambulance gets called, your insurance gets charged. And with all the research we did, and Todd, you might find this interesting too, most of it was like, Blake, what was it, like 90-something% was a fall where they just needed help getting up. They didn't need an ambulance. They didn't need to go to the ER. The insurance companies didn't need to be paying this much money. They didn't need to be paying this much money. And so, Todd, yeah, for you with the ER in your system, but also for us with unneeded ER and the strain that it puts on that system, I think both of our products are helping to hopefully relieve that extra burden on 911.
Absolutely. I mean, it's such a brute force solution, right? Like, just to use 911 for everything, right? I mean, and we see this a lot. So many people don't have primary care doctors. They'll use the ER for primary care. Well, a few pieces of technology in the home could move that needle drastically, so.
And I think
Big.
oh, sorry about that.
No, go ahead.
I said, I think digging at even the deeper problem that you were getting at, that is the need for connection, right? And the need to know that, even for the sandwich generation, to know that, hey, dad's okay. And, the need for, they want to know that they're connected, and that they're being taken care of and that they're being thought of. So even psychologically, a check-in, saying, hey, my daughter's thinking about me, my grandson's thinking about me, And, or, there's that, should I call them? Should I not call them? Are they busy? That, time to open your app and click one button
Yes.
reinforces so much on the psychological and need for connectivity side. So I love that you brought that up because that's definitely where our research and experience has brought us as well.
Yeah, absolutely.
Luke, were you going to say something?
Nope.
Oh, okay. I thought I saw you on mic. I do think it's really critical, this piece about the social isolation and loneliness, and we're seeing the impacts that it can have on longevity and morbidities and those type of things. So I think that is a really important piece. Just to share kind of a funny anecdote, my husband used to work in satellite installation back in the day, and he said he would have some folks that would intentionally unplug their television and have him come out for a service call because they just didn't have anybody else to connect with. And so I think getting creative with low barrier ways of connection and communication and ways to improve, even with the iBot that, lifting up the different ways we're thinking about connection and the psychology of being together is really important. Okay, well, now we've talked about all the great things that you guys are doing. Tell me a little bit about the barriers you see in integrating these tools. I heard kind of mention some challenges around like affordability sometimes. I've heard about insurance coverage. We've talked a little bit about removing barriers with access. So tell me from your perspective, what are some of the challenges you've faced in integrating your tools and what you're looking to do to overcome those barriers?
I'll go if anybody, it's okay.
Yeah, go ahead, Kelly.
Well, one of the barriers for us and for any wearable company is wear it. If you don't wear it, we can't help you. But one of the features that we put in to overcome that barrier that was, we thought, hey, this just might work for living in the retirement living is we implemented RFID into our wearables, so it unlocks their doors. So now it becomes more than just it's like a room key. It's counting your steps. It's taking all that information with falls, but it's also it's the barrier. One barrier that we just ran into is a 3-step care place only allowing their independent assisted living people to have a device to press for help instead of independent. Independent, you're not allowed to have a device for help at this one place that we recently visited. And that's a barrier for us educating them, basically saying, hey, listen, wearing this allows them to stay in independent living longer. We're not calling ambulances. We are taking less of your time in responding to things. So I think the barriers of wearables is making it not just alert, but making it do a lot of things. So, when you feel like you're on that cruise ship and that thing buys your drinks and it lets you in your room and it does all these things, same kind of thing. That was our biggest challenge, was how do we make this look cool so they want to wear it? And we keep showing my dad and he'd be like, lame, not wearing that, so he was perfect. But that was one of our biggest challenges.
Yeah, I
I
think
love it. So, oh no, go ahead, Blake. I was gonna say,
No, it's
I think
fine. I
it's
got
so
delay.
cool that it's like you're taking it and making it look good, but also making it so functional. I am a big like step tracker myself, so that's the number one reason I wear a watch. Not even to tell the time; it's just to set my own goals. So I love that you're thinking creatively about how to overcome those barriers. Oh, Todd's back.
Todd's back.
Yes. Woo! Go ahead, Blake. I didn't interrupt you.
Oh, no worries. I got delay, so didn't mean to cut you off. But yeah, no, I think just kind of talking about risks and barriers, again, that big one that Kelly and I both talked about now is wearing it. But then the other thing is understanding, what the risks and barriers were to the first to market on this was cost and infrastructure and installation and sending people to go, having to constantly fix these things. And okay, well now, one of our things that we've drilled into the drywall of this facility is like non-functional or there's some battery issue. And for us, we recognize it's like, hey, I don't want to deal with any of that. And I hate installing things into my room and into my house. I want it to just be integrated. So, what better use than to take the charger and, have it do everything. And, there's no issue with that. And for whatever reason, if a charger breaks, we just ship them a charger and they plug it in. And that's a huge barrier that, especially for the initial facilities that we have the paid pilots with, say, hey, nobody has to come out there. You never have to see me again. You just get the benefit. And it's for $25 a month. And so keeping that universal, not competitive price, but actually industry leading price per unit, gives us great margins to, increase and gain capital as a business. But really, anybody can afford that in the enterprise living space. And it's been great to catch up with our initial LOIs and to have them say, is it still $25? Yeah, I go, great. So that's been really validating.
Yeah.
Thank you, Blake. Go ahead, Todd or Luke. I'm sorry, I don't know who's.
Yeah, well, I can just speak to, and I don't know what, I clicked something on my camera and it came back on. So
We're glad to have you back.
yeah, just piggybacking on what Blake said, the hurdles really for us are around that logistical piece. So we do have a piece of hardware, so it does have to be installed, on the TV in the home. So somebody has to do that, right? It could be a caregiver, it could be a family member, it could be one of our technicians, but a human person has to go in the house and do that installation. It is simple, it's power, HDMI, plug things in, program the remote, but we don't ask the older person or the patient to do that. For them, it's just we hand them the remote and we show them how to use it. We don't want them crawling behind the TV, plugging in the HDMI wire. So, it is a hurdle of some degree. It's not a showstopper, but that is something that we have to solve.
Yeah, I'd say for the iBot, it's a few things. Logistically, certainly, we have to train our users. So training, depending on what modes they and their doctor order, training takes from a full day to a full 2 days. And it's not a little widget. It weighs a couple 100 pounds. So shipping it across country is expensive, and coordinating deliveries logistically is complex. We work our ways through. We have our own team of clinicians, our own team of service people. These poor folks live on airplanes, basically flying around doing deliveries all the time. But probably more importantly, it's two other things. One is just outdated and really burdensome regulation. So we're regulated as an FDA cleared product. We're regulated by Medicare for reimbursement, and we're regulated by states for our clinical licensure and basically durable medical equipment licensing. In pretty much every 40 states, and we're all 40, require a license. So it's not that regulation is not required. It's there for good purpose. It's there to prevent faulty products from getting out. It's there to prevent insurance fraud. It's there to prevent clinicians who aren't licensed or skilled providing care. But it definitely feels like at times a lot of the regulations are burdensome on the people that would do the right thing anyway, which our organization certainly is, and not enough on finding some of the bad actors that are out there. So that can be problematic. There's some regulations which are just frankly absurd. So Medicare has what's known as the in the home rule, which was written when Medicare was established back in the 60s, which literally says that Medicare will reimburse a wheelchair to the extent it is needed for activities of daily living inside the home. So it's basically saying, if you have a disability, we don't want you to leave your house. And the rest of the industry has kind of devolved to design and manufacture these barely functional, I would argue, and frankly unreliable products by and large. There are some good ones out there. For example, if you read the user manual for a standard wheelchair, it says don't drive it in the rain, because it's not rated to be used in the rain, and it'll short out in a lot of cases. It's crazy. You're going to be in the rain. You're a real person who wants to have a life. You're going to get caught in a rainstorm. Another one is that Medicare, and because of Medicare private insurance, companies require a prescription not only for an initial wheelchair, but every subsequent wheelchair and every service you get on a wheelchair. So every time a customer calls us and says, okay, I had a wheelchair for the last, whatever, 8 or 9 years, I want a new one. If you have spinal cord injury, if you have MS, if you were born with spina bifida, if you were born with cerebral palsy, and you've been using a wheelchair, guess what? Unfortunately, you're not going to be walking again. You need it, but they have, not us, they have to go through all these process steps to get in, get a doctor, get a prescription, get a referral to a physical therapist. And even in the case of service, if they have a wheelchair and their prescription is more than 6 months old, they have to go back to the doctor. And it adds again to this, if your wheelchair is down, it's like your leg's not working. 80% of the time, if there's a wait in service, is getting prescriptions, getting insurance clearance, not the service. The service itself, we can do a lot of cases overnight. And so I think the regulatory environment really needs to catch up and just get a little bit more sensible about how they, especially in disability. I can't comment on your guys' field, but in the field of disability, it just doesn't, you can very easily understand from a prior diagnosis whether someone is still going to be disabled. Like, if they lost their legs, they're not going to grow back, folks. So why are you making a poor veteran go get a prescription again? But the government moves slowly, as we know. So, and we're part of different advocacy groups working with users and disease-oriented advocacy groups to get that change, get those sorts of things changed. But it's very slow moving. And at the end of the day, most of it ends up hurting the users. It doesn't, and it adds cost to the product and mostly just delay to what we can do for them. So
Right.
that's
That barrier is a big old barrier, Luke. We could talk about it all day. That's a huge one. Regulation is a high wall to climb. Thank you. I want to thank you all for sharing. I want to give just a moment here to kind of, is there anything else about your product, your organization, any final notes you want to make to our audience? I really wanted to ask the question about how we can all collaborate more to make sure adaptive tools are more available to people, but you can answer in your own way. I'll give you all just a minute here to share some final thoughts with our group.
All right. Well, I'll go.
That's great.
Yeah. So collaboration, key word, very important word, in my opinion. The aging in place challenge is deep and wide and multifaceted. And, it is truly going to take a village or a small army of orchestrated solutions. Each one of us solves a slice, right? But probably no one company could have the scope to solve every facet of the problem. So we think it's going to take collaboration and cooperation. And in order to do that, we kind of have to get over this territorial, there's a default, I think, and, I'll stop on my soapbox, but tech companies tend to, want to carve out their turf and defend it. And, you can build a business like that, but it's limiting, and it also doesn't serve the total problem. So, I think that's a very important keyword for to wrap this up.
Thank you, Todd. So collaboration in all caps, baby. We need more collaboration. I like it.
I've got it, if it's okay.
Go ahead.
It's things like this, actually. Just Blake and I going to more things like this, meeting more people, meeting people like Luke and Todd, where I've just learned about 2 new devices. So now when my circle keeps getting bigger and bigger, and more of my friends are in my situation with different parents with different needs, it's spreading the word about what Todd's doing, about what Luke is doing. And I think the more that we as companies come and meet each other, the more we can go, oh my gosh, have you met so-and-so? They're doing this and it's really similar. And I think you guys would love each other. And like he said, not being there's enough trust with our boomer generation coming up. There is enough for everyone. But it really is, where's your heart? Is your heart in it for money, or is your heart in it to help people? And if you meet other people whose heart is in it to help people because you're living it, then there's enough space for everyone. And I think that really, it's like what Todd said, there's enough room for everyone, and it's meeting people and having that heart for others that will truly make the difference.
Thank you, Kelly. And I just wanted to highlight earlier when Kelly was talking about the sandwich generation and the challenges she's facing as a mother and somebody caring for an older adult. That's what Family Caregiver Month is all about. Your story is so quintessential to the experience of so many people in our community. So I also just want to give you and everybody else who's a caregiver out there a big big snaps because it is a lot of work, and a lot of people get put into that situation not knowing the resources that are out there, the technology that could support them, all of that. So I just wanted to say that as well, and then I'll pass it over to the next group, next person.
I don't know what I can add to what Kelly and Todd said. I think that's a really, really good point. I think just if you lead an organization, you obviously have to evangelize almost by definition. If you're doing something different that hasn't been done before, you got to tell your story to as many people as you can and make connections to as many people as you can. You know, I think the point about if you just serve your customers is entirely correct. I would add that sometimes you got to tune out other voices and forces when you need to do that. In my prior career, I'd worked for companies, all tech, all health related, some that were backed by investors, some that we just bootstrap from the scratch. And the investors always don't see things. The financial folks don't always, they're not bad people per se, if you're lucky. But they can be more focused on nearer term metrics. But at the end of the day, the smart ones realize if you really serve your customers, it's going to be a bigger success for them. If you really serve your customers, all the other stuff is going to fade away if you really listen to them. So that's my take on it. But I definitely, thankfully not at Mobius because we don't have any outside investors. But in my past life, there was that tension. You know, you got bills to pay. You unfortunately, for some companies, you have more than one constituent you serve. It's not just, you know, the customer or your employees yourself, but if you can manage that, that's key. So.
Okay, well, I want to say thank you to all of you for being here today. Genuinely, I was excited to hear about what's been going on in the world of tech, and I appreciate the updates, the information about your organizations. For those of you in our audience today, our CEAL Tech Talks will be back in the new year in 2026. So if you have a tech company that you would like to be on the panel, or if you are just interested in learning more like I was, tune in, I think in January or February. So if you want to learn more about our webinars, go to CEAL's website. We will have this great panel up there in just a few days. And otherwise, we will see you soon. Thank you, everybody.